And Germany has updated its guidance after the World Health Organization warned that Europe was risking a new wave in August due to the relaxation of restrictions, the spread of infectious COVID-19 variant, and also low vaccination coverage. Well, according to the global body, due to increased mixing, travel gatherings, and easing of social restrictions, the Delta variant would be dominant in the region by the end of summer. While Professor Tobias Kurt is a professor of public health and epidemiology and director of the Institute of Public Health at Charité Berlin. He joins us on the program for more. Thank you for joining us.
Good evening from Berlin.
All right, first, it was the pandemic 2020, now it's the floods. How has that affected the COVID-19 response? Because it would seem that, at the moment, a lot of people are coming together in tight spaces just to overcome the crisis together. It must be a huge task for government at this time.
Absolutely. It has been a disaster, and these natural catastrophes remind us that global warming or climate change is really already a major public health issue. So compared with the pandemic, luckily, I would say it was limited to some regions, and obviously people have to gather together to respond to the flooding, and it was not such a mass event, such the Kumbh Mela in India or maybe the European Championship in soccer or football. So I don't think it's a major risk factor for the pandemic to grow further in Germany. It's more important that people get help and relief who've been suffering from the flooding.
But we also hear that state governments are scrambling to set up mobile COVID-19 vaccination centers. Western Germany, for example, as the rescue efforts increase the threat of infection. But residents are saying they have bigger concerns than the pandemic now. What do you think? Is the coronavirus threat still very real in Germany?
Right now, we are on a very low level of incidents or new cases that occur. And that's a usual scenario that when the pandemic is not felt that aggressively, so to say, then people are not as willingly to really accept vaccinations. But we are a very lucky country to have vaccines available, and people are accepting vaccines. So about 50% have now been vaccinated with 2 shots and 60% with 1 shot. So that's already not so bad. What we have to do better. And so we are more flexible. We're providing flexible vaccine solutions where people can just go to a bus or to a local store maybe and get vaccines, similar things that happen to the US. So hopefully people accept that. Some have doubts, that's okay, but we're trying to convince and say, look, that's the best way of really not getting sick and fight the pandemic.
We also know the WHO sounded a sort of warning, and this was during the Euro 2020, the crowds, the surging numbers to come from COVID in the coming days, weeks. Do we know if Germany has witnessed any surge as a result of the games?
I don't think so. So not many Germans were allowed to actually travel to the UK, where we have the Delta variant, obviously. But people are traveling to other countries where they meet a lot of people from many countries. And so that may be part of the reason why the number of infections are increasing right now. But I also have to say PCR positive, if you are in a country where many people are vaccinated, doesn't mean the same thing as before. So we have to be a little bit more careful in evaluating these numbers. Nevertheless, we have to be really looking at these numbers. And yes, the Euro 2021 was not such a really unrisky event. So I think they should have been taking more care of the public.
So looking at the numbers, especially the epidemic curve, what role is the Delta variant, which appears to be a threat all around the world, what is it playing on that curve?
Well, it's also playing a role in Germany. Obviously, this is now the variant which is driving the increase in numbers of infections that we see. And in a couple of months, we will see the next variant that is just the normal way of a pandemic. So luckily, the vaccines so far are working against the Delta variant. So they prevent from severe illness. So they also prevent from spreading not entirely, but they prevent from spreading the virus to other people. So it's important really to get vaccinated and also be respectful to the pandemic, wearing masks, keeping distance whenever possible.
I want us to talk about vaccine mixing, because we've seen it with, German Chancellor Angela Merkel and a few others. But, the study and the report coming from Europe says that, it actually is better in terms of boosting and the sort of levels it gives to keeping one safe from COVID-19.
So I think the numbers, if you compare them, they're like minor differences. Really, if you have 2 vaccine shots, whatever the vaccine was, you're really, really well off in terms of fighting the pandemic for yourself and to prevent others from getting the disease. The mixing from AstraZeneca in this case with the BioNTech Pfizer vaccine seems to work pretty well, but I think others are also pretty much at the same level. So I don't think people should focus on which combination or which vaccine they got. So far, all of them are working, and if you have received any vaccine, that's really a great message.
Finally, what's your advice to countries and their governments the best way to beating the pandemic that seems to be unabating?
Well, depending where you are, unfortunately, in the world, it's like if you have access to vaccine or not, and if you can distribute the vaccine or not, if the public is ready to accept the vaccine or not. So it all depends on that. So health communication, obviously, is very important, that the public's been told and advised to keep a distance, wearing masks, getting vaccinated. Also information about vaccines, about risk and benefits. Obviously, the benefits are outweighing massively the risk. So all of this is important in terms of informing the public in your country, in your setting. And it really depends on your specific setting, what you can do, what you can tell the people, and also how you can improve the situation for the public.
We'd like to appreciate your time. Thank you so much for joining us on the program. Professor Tobias Kurz, the Professor of Public Health, Epidemiology, Director of the Institute of Public Health at Charité Berlin. Thank you.
Thank you for having me.